People that have already tried topical therapies like steroids or topical calcineurin inhibitors like Protopic or Elidel. And when that fails, then we move on to something like either light or injectable Dupixent. So for our patient today, she's getting her first treatment with Dupixent. So that's 2 shots, unfortunately, for your first treatment. And then every time after that is just 1, and you inject every 2 weeks. Most patients can start to do it at home after they get used to it for a little while.
So McKenzie.
Hi.
She's already had 1.
And I'm sorry, like, why are there so many people here for this treatment? Like, is this a difficult treatment?
No, so we're training the nurses today on how to give the injection.
I see. I was like, wait a second. To me, it looks like it's just a shot, but she looks all tense and stressed out.
No, I'm not. I'm trying to keep my sleeve up.
Okay, so it's you've had shot 1, and you're saying no big deal. Like, no need for 5 people in a room to do this.
No, well, I like all the support, but
you like all the support. Okay, so,
we just love her.
And
So.
we're gonna get ready to do the second injection.
Yes. So
Okay.
I have the Dupixent here. First, we cleaned her arm with alcohol, and then this is a sub-Q.
I know.
Situation
It's
there.
very fancy.
Like, whoa, that's a lot. Okay.
So this one's the after. So basically it's a spring-loaded syringe, and we want to inject it into the subcutaneous space. So we'll see when Christina does it, she kind of pinches the skin up to make sure that there's more fat and less muscle there, because you want to inject it really into the fat and not to the muscle. Like a lot of vaccines that you do in the arm, you want it in the muscle, whereas this one is a subcutaneous injection.
All right.
And it does have a lot of volume.
Let's do it.
Let's
look,
do
we have
it.
It's a big guy.
nails.
Oh.
Beautiful. So here it is. And again, we cleaned our patient before. That's very important. I'm going to squeeze right here so we get the sub-Q, the tissue that Dr. Lewallen was talking about. We squeeze, little poke in, and then we just deliver.
Deliver.
Get her the goods.
Yeah.
So, sometimes when you get an injection, you feel like a sting or a burn when you feel the medication going in. Do you
No,
notice anything like that?
it's like a little sting at first, and then you can kind of feel it because it's a lot, but it doesn't hurt. It's not at all. It's very comfortable.
All right. And then look at the end. Protection, so you won't poke yourself.
Beautiful.
I know.
So then the first time, you have your training wheels on, you got people helping you. And then so next month, the plan is you're going to inject yourself or?
I won't, but
Yeah, so
I want to.
It's every 2 weeks for Dupixent instead of every month. So every 2 weeks she'll get injected. Most of the time I do it in the office until patients feel comfortable. And then a lot of times I'll do it into the arms, but patients tend to do it into their stomach because it's hard for them to reach their own arms. But you can do it into the stomach or the thigh area if you wanted to do it at home.
Probably easier to
She's
find
here-
that non-muscle like fat in your stomach too. You
Well, a
just
lot
sit
of us,
down and
yeah. A
bend
lot of us,
forward.
that's definitely true.
I can find some on me.
Yeah.
Yeah. Okay.
Yeah, but since she works here, it's easy for us to just inject her. But for most
Yeah.
patients, it's more convenient for them to do it at home because you don't have to come in the office that frequently.
Got it. And so, she's got the 2 injections. It's her first time. What will she be feeling this week? Like, how will her eczema improve over the course of will she see improvement this week, next week, 5 weeks?
Usually it's about 6 to 8 weeks for you to start to see a lot of improvement. So she's going to continue on topical therapy until we get, a good amount of the medication in her system. This, as her first dose, it was a loading dose. That's why it was 2 shots to try to get it on board as quickly as possible and working as fast as possible.
And so, McKenzie, we can edit this later if you don't want to share this personal information, but how does eczema affect your day-to-day?
Well, I don't like the way it looks, and it's really itchy and uncomfortable.
Where do you have
So, really all over.
it? All over.
My arms, my legs, my hips.
Sounds like the beginning of a song.
My
My arms,
arms.
my legs, my
Yeah.
hips.
So I'm really excited for this because I use topicals. I've used topicals for years. So
And looking at her hands,
Yeah.
because she works in a medical office, you can see the eczema here and all the way on the hands. on
Yeah,
the
I mean,
arms.
people say eczema all the time, but not everybody knows what it is or how it affects people. And so, truthfully, I mean, people can be debilitated by eczema, right? Like, they can literally be so uncomfortable that they don't want to, leave the house. They don't want to do they not want to shower? I don't
Sometimes
know.
water can like sting or burn. A lot of times the most difficult thing is that it affects sleep. And when you affect sleep, that can affect your mental function as well, especially in kids, because eczema is pretty common in children, and it can affect their sleep and then their school performance, their psychological health.
Why is it more common in kids?
Just that basically a lot of kids will outgrow eczema. So most people don't have it into adulthood. She happened to have it in childhood that grew into adulthood. So it's just a more common kind of pediatric illness, but it definitely can affect adults as well.
So, and you may have covered this at the beginning, but I'm not a good filmer, and so I was stressed out about that. So, Dr. Lewallen, she's going to have this course of treatment. She did the two loading doses. She's going to come back every 2 weeks, and she's going to start to see improvement in 6 weeks. Is this like shots forever? Shots. Or is it like she's going to be healed, like not have this forever?
Yeah, it definitely depends on the patient. So since McKenzie's had it since she was a child and it's gone into adulthood, then it's more likely that she has chronic eczema, that she would need to do a treatment chronically. For some patients, they have it that is a new onset as an adult, and they might be more likely to be able to get off of the treatment over time.
Okay, beautiful.
And same for children. Most of them will outgrow it. So a lot of times you can start the shots in children, and then they'll outgrow it by the time they're kind of, 8 to 10.
So, McKenzie, like when Dr. Lewallen was like, Kerry, come in, let's do this Dupixent thing, I was like, for eczema, I guess I was insensitive, and I didn't realize how big a deal this is. Like, this is a big deal. This could actually affect your sleep. Like, you could be more well rested. You could be just more comfortable day to day. So I'm really happy for you, and I'm excited to see your progress and, see how this goes. So the scientists over there at Dupixent and everybody who contributed to make this medicine, to make my McKenzie little happier and healthier and, feeling better about her day to day, props. Thanks.